Hello, I'm your host, Peter Komendowski, and welcome to Surviving Bad, where we explore stories of survival, hope, and inspiration. Today, we talk about the dark side of marijuana withdrawal. Early intervention and treatment can face withdrawal symptoms that may be the least understood aspects of marijuana use and a serious threat to the quality of life that users often seek. Our guest, Libby Stout, is a certified addiction psychiatrist and former medical director for a program specializing in persons struggling with substance abuse and mental illness that often have failed at other levels of treatment. Libby, welcome to the show. Please tell us a little bit about yourself and why you're here today.
Well, thank you very much. Good morning. I'm happy to be here. Yes, as you mentioned, I'm an addiction psychiatrist, and I've been working in this field for the past 33 years. For about 20 of that, I was the medical director for this program that was at the state hospital in Colorado. It was actually funded by the state of Colorado. And it was for people, as you said, who have failed everything else. And so we had people who had been in multiple previous treatment programs. The majority of them were referred by some legal problems, so probation, parole, diversion, about 80% of them. And we had really great outcomes. And I think a lot of it was because it was 90 days. It was totally abstinence-based, including tobacco, which I spent a lot of time working on to convince people that's the best way to help somebody have really good recovery. And we just did a really great job. However, when Colorado legalized marijuana, and initially it was medical, and that was back in 2000. And at that time, I wasn't really worried about it because, I mean, we had been seeing people with marijuana issues for a long time, but it was never a big deal. And back then, the highest potency of THC was 5%, and we didn't have concentrates. So then in 2012, we legalized recreational, and the doors opened in 2014. And I started seeing really significant problems, especially because we had created a law in 2016 that said that people on probation could use medical marijuana if they had a medical marijuana card. So if a doctor had recommended they use it, then they should be able to use it even though they're on probation. And so I started seeing people coming into my program high on really high potent products. And I started seeing things that I had never seen before, like the worst psychosis I have ever seen, worse than methamphetamine, worse than alcohol. And I also started seeing people not doing as well. I mean, for many years, we had about 80% successful completion of the program, meaning they stayed the entire 90 days and they did well, and then they went out and continued in outpatient. We started seeing decreasing ability to do well. And I think that was a lot because this is a very highly cognitive behavioral program, required a lot of attention and focus and intelligence. And I would do cognitive assessments on admission. And I started seeing really worse cognitive assessments on these people that were using high potency THC. And then it would take a long time for that to leave their system. As you said in the beginning, marijuana withdrawal is something that we are now really having to deal with. Because back in the olden days, when it was less than 5% THC, we didn't really think it was that addicting. Now, with these really high potency products, it is extremely addicting and very difficult to get off of. Many people are having to go inpatient to get off of it.
Now, what makes it physiologically more difficult? I mean, I suspect because it's fat soluble, not water soluble, so it stays in the system longer. But besides that, this idea of withdrawal really goes against what a lot of people are saying, that marijuana is not addictive.
Yes, that's a huge problem that the industry continues to tout that. The industry keeps saying it is not addicting. This is no different than the tobacco companies. I have a picture of the New York Times front page in the 1990s where all these tobacco executives are standing in front of Congress, raising their right hand. I swear it's not addicting. And we know that's not true. And so this is what we're now seeing with the high potency THC. And now studies are showing that up to 30% of people that use it regularly are developing addiction to it. And it's higher if you start using before the age of 18. So if you start using as a young person during puberty and adolescence, that's when it's worse.
Well, this is a fascinating subject. I look forward to continue our conversation after a short break. We'll be back with Dr. Libby Stout. Stay tuned. You don't want to miss this.
The black truck? Hey, Christina from accounting.
Yeah, hi.
Hey, I used to date a girl named Christina.
Oh, really?
Yeah, and then she dumped me for my best friend. You want to see some photos of them that I took?
I don't.
I thought we talked about this, buddy.
Buzz and overshared again?
Yeah.
Yeah. I'm gonna call a car.
That's a smart idea.
So yeah, I know, that's why I did it.
Hey, you're gonna get back to the top of the mountain.
Does that mean I'm gonna get back with Christina?
No.
Oh.
No.
Every second, 127 new devices connect to the internet. You can feel it happening. Our digital world expanding with every breath. We're entering a whole new era of connectivity, and MediaCom will be ready to power it with one of the nation's first 10G platforms. We'll be bringing you more speed, more capacity, more security, and the power to do more than you ever dreamed possible.
Welcome back to Surviving Bad. We're talking with Dr. Libby Stout about the impressive body of knowledge of marijuana use and addiction that's beginning to make its way into the mainstream of essential information, especially this idea of withdrawal, which goes against almost everything we've been told about using marijuana. Libby, please tell us more about this.
Okay. Well, initially in the olden days, when it was very low percent THC, it was more of a psychological withdrawal, but now we see a true physiological withdrawal, and it really does affect people negatively. And so the number one symptoms are increased irritability, anger, anxiety, massively craving marijuana. It's like that's the only solution. And that's true for all addictions. Withdrawal is very stigmatizing. And so it's very difficult for people to acknowledge they have a problem and accept help. And so one of the things that happens when people that are using marijuana chronically, they initially think they're using it for anxiety. And then when they are in withdrawal, the anxiety is worse. And so they're thinking, oh my goodness, no, it's treating it and I just need to use more. And so people use more and more and more because they're developing tolerance to it. And then the withdrawal gets worse and worse and worse. And there's really some excellent research showing that this is happening, especially in people using it medically. And that makes sense because if you're using a medicine to treat an illness, you don't use it intermittently. You use it daily, sometimes every day, all day long. And that is setting people up for the withdrawal, especially if they're using the higher potency products. The biggest problem is anything that is 10% and over. And that's where we're seeing kind of the cutoff, because there is research looking at low potency, balanced THC, CBD, showing there's some benefit for some medical purposes. And in fact, we have FDA approved THC that is a medicine that people use. But when we get into these things like wax, shatter, people are dabbing very high potency stuff or vaping high potency hash oil, then we're getting into the problems where you start seeing the withdrawal.
I have a question for you, because when we often have conversations on the show about stigma, it's usually a population of people stigmatized towards another population of people, and that builds barriers to intervention, treatment, access to services, things like that. But it almost seems like a self-stigmatizing mechanism, like it's almost a psychological split personality, that you yourself are stigmatizing withdrawal. And it's a very personal, private sort of cycle of self-destruction that evolves in a human being. Am I over dramatizing this, or is there some validity to that?
No, I think there's huge validity to that. I mean, if you think about withdrawal to any addictive substance, it's miserable. And people are miserable, and they don't want people to know they're miserable. And there is a simple solution to deal with it, which is using the substance again. And that's why I think a lot of people don't ever seek help, because they've stigmatized themselves in terms of the withdrawal that they're experiencing. And so we definitely are seeing that with marijuana, because people are still believing this I couldn't possibly be addicted to it. It's very similar to what we're seeing with the cannabinoid hyperemesis syndrome, which is really related to addiction or cannabis use disorder. People are not getting that horrible syndrome unless they're using regularly. And so they're using
And that syndrome is the one that they all like refer to as scromiting, where they have this uncontrollable vomiting and things. So it's just a really, really scary event in someone's life.
Absolutely. And it's devastating when somebody is using this product that's supposed to help with nausea and vomiting, and now they're getting horribly nauseated. They can't stop vomiting. They have horrible stomach pain. And it is so hard to convince them that it's marijuana causing it. The sad thing is, once I've been successful convincing somebody that the marijuana is causing those symptoms, then they agree, oh, I should quit. And I say, good, can you quit? And they say, oh, sure. And then they try and they can't. That because of the withdrawal. And that has been very frustrating, because then I'm recommending they go inpatient, but most insurance companies do not pay for cannabis use disorder treatment. They see it as just cannabis.
Well, we're going to continue that conversation, because there may be a precedent. We're seeing some insurance companies starting to pay for opioid addiction treatment. So maybe there's a new world opening up, but that's not necessarily a good sign if we need it. We're going to take another short break. When we come back, we'll continue our conversation with Dr. Libby Stout. See you all after the break.
Multiple studies have shown that marijuana can slow both driver reaction and response time, which can be really dangerous. He's here. He's here.
Wait. What?
I can't drive.
Why?
My.
Oh.
Welcome back to Surviving Bad. We're talking about marijuana, addiction science, mental health, and innovative approaches to treatment that are probably going to be real important as we see marijuana addiction growing to unprecedented levels. Libby, can you talk about these new innovations and some approaches to treatment that people may not have heard of?
Well, there are actually several companies now working on what is equivalent to a MAT for marijuana. So MAT is medicated assisted therapy. And we know that we have that now for alcohol. We have that for opiates, like in the form of buprenorphine or methadone. And so some companies are coming up with substances, and many of them are working on things that are already in our pharmaceutical arena, like the cannabinoids, like using Marinol or dronabinol or nabilone.
Which are
And then,
available through prescription, from a
right,
doctor's prescription
exactly.
through a pharmacy.
Yeah.
Okay.
And I know of some people that are actually attempting to use those to help people in the withdrawal process. I don't know how successful it's being right now. Most of these new things are only like in phase 2 trials, so we don't really have a lot of data on them yet. But there are other things. I mean, there are treatment programs that are getting even Medicaid to pay for cannabis use disorder, but it's only when the person has such severe problems with it, like psychosis. Because if somebody is put in an inpatient treatment program and they're acutely psychotic, it takes a while to stabilize them. And so I know of some treatment programs that are getting like up to 45 days inpatient, but a lot of that time is wasted in terms of substance abuse treatment because you're really stabilizing the psychiatric side effects of the drug. But in our treatment program, we did a lot of complementary treatments that I found to be really helpful. So one of them is it's a standardized ear acupuncture protocol, which is 5 needles in both ears. And a lot of people think, oh, that sounds really weird, and how could that possibly work? But it was initially developed to help people coming off of heroin. So it really helps people in the detox period. And I've actually used it inpatient to detox people off of heroin, and it works. But what we were finding is it really did seem to help, because what it helps with most is stress, anxiety, and sleep. And so when somebody is in an inpatient setting, the biggest problem is they can't sleep because they've been using these substances to help them sleep, and now they can't use the substances. And so this is something that has been really, really helpful. It took me 3 years, but I was able to get a law passed in Colorado where we could train pretty much anybody to do this. Initially, it was just people with licensed behavioral health people, but we now have it expanded to where we can train anyone with a profession. So we're training peer coaches, which tend to be the best people giving this treatment because they're really helping their peers. And it can be used in all different levels. But one of the interesting things I found about it is it really did seem to help with the cannabinoid hyperemesis syndrome symptoms when somebody was inpatient.
I have a question for you because we have a world where we really talk about mental health, and we know that stress and anxiety, a lot of people don't categorize that as a mental health issue. They think it's normalized in their behavior, but yet these are often catalysts for people self-medicating, which creates worse problems. So there's sort of a scope of early intervention, because I don't know that I've ever heard without substantive supervision by a professional, whether it's a psychiatrist, psychologist, or a medical doctor, it's almost extremely difficult to self-medicate for the problems that you yourself are having because you're so biased in your need. Is that true? I mean, so I can see why the acupuncture to reduce the anxiety and stress would certainly take away one of the major factors that make people reach out for these drugs.
Yeah, well, no, and that's what in my treatment program in the 90 days, the components that were really, really effective was teaching people skills to manage anxiety and stress, because you're absolutely right. That's why people use this. And so initially, this ear acupuncture is something that helps because it's something somebody is doing for you. But then we also would teach people things like tapping. I mean, if you know about emotion freedom technique, where you tap on acupuncture points. We would teach people biofeedback based on heart rate variability. There's several programs out there. We were using the one called Heart Math. And then teaching people other skills using just relaxation skills, because that is what people need when they're out there in the real world how to manage that without using substances, without getting into that.
Well, these are fascinating ideas. We're down to just one segment left, and I'm really interested in hearing some of the advice you have for people that may be dealing with these issues. So we're going to ask Libby after a short break to share some comments, insights, and inspiration. Stay tuned. You don't want to miss this.
Today, more than ever, you need fast, reliable internet. At MediaCom, we want you to know you can count on us. Our fiber-powered 100% gigabit technology network was built for the future. We have enormous capacity and power and 99.99% network reliability. So even though these are uncertain times, we're prepared. And you can be certain we'll keep your world connected. Every second, 127 new devices connect to the internet. You can feel it happening, our digital world expanding with every breath. We're entering a whole new era of connectivity, and MediaCom will be ready to power it with one of the nation's first 10G platforms. We'll be bringing you more speed, more capacity, more security, and the power to do more than you ever dreamed possible.
Welcome back. Today on Surviving Bad, we've talked about the dark side of marijuana withdrawal and some innovations that can help. Well, let's see what other insights and inspiration our guest, Dr. Libby Stout, has to share with us. Libby, the floor is yours.
Okay, well, I guess my biggest message to people is to recognize that this is a real problem. And it really is the higher potency stuff, which is now ubiquitous. You can, when I'm working with a patient trying to get them to cut down or not use, and I want to do the harm reduction approach, I tell them go to the dispensary and get the stuff that's 5% or less, because there's research showing that that didn't cause psychosis. They come back and tell me it doesn't exist. And most of the research has shown that pretty much everything is 15% or higher that's available in dispensaries. I looked at Iowa's websites for marijuana and found that, that it looks like everything is above 20% in the plant. There's some that are like almost to 30% in the plant. And then, of course, you have all the things that go all the way up to 90% THC. And so I warn people about that, because there is now research showing that with the higher potency THC, that people are developing addiction really quickly. If you think about alcohol, for example, it takes years to develop addiction to alcohol. You have to really work at it. And what we're finding is that you can develop an addiction very quickly to this.
This speed of addiction, coupled with the difficulty to break the addiction because of things like withdrawal symptoms, it seems to me that there should be many, many more warnings or buyer beware sort of messages about marijuana compared to even other substances like alcohol that they might use.
Oh, absolutely. And that's, we did have a bill in Colorado back in 21 where we were successful in getting warning labels on concentrates. I don't know that they actually hand them out, but we were able to get warnings on, the fact that it causes psychosis, it increases the risk of addiction. The one thing we were not able to get on there, which really disturbed me, was the fact that it's related to suicide. And there is so much data out there showing the increased risk of suicide with marijuana. And like there's this one study looking at people on MAT for opiates. So they have opiate addiction, they're on something like buprenorphine or morphine, methadone. And then if they're using cannabis, and it doesn't matter how much, how often, increased 40% risk of suicidal ideation. And, we think about, there's so many people dying of fentanyl overdoses, and we don't ever know if they were accidental or intentional. And with this data now showing that cannabis can increase the risk of suicidal ideation and attempts, perhaps that's playing a role in that. And I think people need to think about that and pay attention. People also need to be concerned about starting early. There's a phenomenal researcher called Yasmin Hurd in New York who does a lot of research on the intergenerational effects of cannabis on the developing brain. And basically, her data shows that no one should be using cannabis unless you're 25 years of age or older and you never plan to have kids, because there's evidence that it affects the gametes, like the egg and the sperm, which then affect the developing brain of the offspring.
Wow, this is all powerful, powerful information. As we look at this problem, I know Dr. Ken Finn in Colorado once shared with me that now the highest correlation of a substance use or any other stimulus related to attempted suicide by a teenager is marijuana use. That is the most commonly found precursor or participant in the process of suicide attempts, which of course with ideation, who knows what the percentage is. What would you tell parents and kids? I mean, if you had 15 seconds to say, hey, when you're looking at marijuana, you need to really do, what would Libby say to like a grandchild, a child, or a young parent?
If you really want to use it, wait until you're 25.
Is it riskier, in your opinion, than alcohol? Because people keep saying that it's not.
Yes, absolutely. It definitely is. Because the cannabinoid receptors that it works on are responsible during puberty for the brain deciding what are we keeping and what are we getting rid of. And so we have our own natural system that does that. And if you put THC in the brain, it blocks that ability. Alcohol is, water soluble. It's out of the body in a short period of time. This stays around.
Dr. Libby Stout, thank you so much for sharing these important messages with us today. And thank you all for watching. Check out our website at healthyiowa.org and keep your eye on MediaCom MC22 for our next episode of Surviving Bad, where we explore stories of survival, hope, and inspiration on MediaCom MC22, your local programming leader.